as you know, not everyone agrees with the president's push to reopen at least parts of the economy by Easter Sunday, or even, as he puts it, reopening large sections of the country. Funny thing about this virus, as we've said, it doesn't respect state lines or calendars. Here's what Microsoft co-founder Bill Gates had to say about relaxing social distancing measures in order to help the economy.
There really is no middle ground. And it's very tough to say to people, hey, keep going to restaurants, go buy new houses. Ignore that pile of bodies over in the corner. Just, we want you to keep spending because there's some, maybe a politician who thinks GDP growth is what really counts. It's very irresponsible for somebody to suggest we can have the best of both worlds.
We're very happy to have back with us tonight Dr. Michael Osterholm, professor and director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Also happens to be co-author of the recent book, Deadliest Enemy, Our War Against Killer Germs, which he somehow knew how to write before this pandemic arrived. Doc, you and I spoke, just seems like it was a couple of years ago. It was St. Patrick's Day during our coverage of Super Tuesday, edition 3. You said you estimated we'd still be at this, dealing with it by autumn. Have you seen anything, heard anything to change that prognostication?
I have not. At the time, I mentioned to you that while there are a number of people in Washington that were treating this like a Washington, D.C. blizzard, a couple of days and we'd be out of it. And I said at the time that this was going to be basically a coronavirus winter. We were just in the first weeks of the season. Nothing has changed at all. I think what has happened, however, is that the enormity of just how big the problem is now makes people really find it difficult to understand how it could get worse, but it's going to. And it will continue for the weeks and months ahead.
I promise to never drag you into politics or try to convert you into being a politician. But coming off what you just said, when you hear the president talk about getting us out and about, filling the churches on Easter Sunday morning, what does that do to you?
Well, first of all, let me put it into context. I've been in the public health business for 45 years. I've served roles in the last 5 presidential administrations. I served 2 Democratic governors, 2 Republican governors, and 1 independent governor here in Minnesota, state epidemiologist, and no one can tell you my partisan politics. So please take this comment as such. But right now, we don't have a strategic national plan for this. The administration has failed to deliver anything to us that would give us a roadmap of where we're at, where we're going. And we need that desperately because we are not going to get out of this anytime soon. And one of the things that we've learned about viruses, they cannot be convinced to do something different by rhetoric. They will do what they're going to do by Mother Nature's hand. We have got to understand that now.
I want to play you a quick interview with an ER doc, Elmhurst Hospital, Elmhurst, Queens, a place I hasten to add that pulled up a refrigeration truck today to serve as their temporary morgue.
Today is kind of getting worse and worse. We had to get a refrigerated truck to store the bodies of patients who are dying. We are right now scrambling to try to get a few additional ventilators.
Doctor, how far above capacity are our hospitals going to be running and when?
Well, first of all, I wrote a piece back in 2005 that talked about our lack of preparedness for a pandemic, and I wish it were 2005 again because we were much better prepared back then than we are now. We have basically gnawed our healthcare system down to the bone. There is no resiliency. On a given day, 95% of the beds are already filled. We have no excess capacity for ventilators. I think one of the greatest tragedies is going to be many of our healthcare workers are going to suffer this infection, and some die because of acquiring it at work because we don't have the protective equipment to protect them. And so I think this situation that's playing out in New York is obviously a very, very dramatic picture. And it will play out in other places around the country. And I think we have to understand that the healthcare system as we know it will be overwhelmed. there will never be another normal time. It will be a new normal, and we will understand what it meant to overwhelm a healthcare system unlike anything that's ever happened before.
Wow, that gets our attention. We're going to ask to talk to you again if you'd be so kind to join us from the Twin Cities. Doctor, thank you very much
Thank
on
you.
this day when we learned Atlanta and Detroit are already out of ICU beds. Coming up for us, perhaps you've heard of the Spanish flu of 1918. Well, for starters, it wasn't Spanish at all. There's a whole lot more to know about it that might help during these times. The man who wrote the book is standing by.